Kia ora, everybody. I'm sitting with my old physio, Naomi Carter. She helped me out a lot playing at Hotapu. First year there, were you new grad or were you on your final placement?
Final placement was my first year there. Yeah.
Yeah. No, and then your first year there, you were running the big team.
Yep.
Mate, before we get into your story, what did you do last weekend?
Last weekend, went to the beach fishing.
Nice. And success?
You know it.
Yeah. And so how's the fishing side of things been as a release? You were always into a bit of outdoors, but yeah, how do you have fishing there?
It's different now, but no, it's all good. Yeah, it's just finding different ways to do things. So yeah, it's good. Getting out is good.
Yeah, right. Yeah. So we'll go into the heavy stuff first. Tell us about the day that changed your life in most ways.
Yeah, in every way.
Yeah, every way.
So it was a Wednesday, same as any other Wednesday, really. Went to work, went from the work to the gym, did my favorite class at the gym, and then drove home. It was like 7:20 at night, and parked on the side of the road on a grass verge. And I don't remember much else, but from what I've been told, I got out and then was getting my gym bag out of the car, and a distracted driver drove off the road and collected me in my car. So threw me up in the air. I went up over his car, over his windscreen, landed on the road. He drove to the end of the road before, he was in shock, I guess, and then stopped. My neighbours saw the whole thing, so it was pretty gruesome for them, and they provided first aid straight away and called the ambulance, and then sent to hospital in the ambulance. Lots of broken bones, lots of blood, that sort of stuff. And then so Richard got a knock on the door from a police officer saying that what had happened. So it was pretty much right outside our house. And he got put into a separate ambulance and taken to hospital. They let him in to see me when he got to hospital. And I was in a pretty bad way, so they were intubating me, so sticking tubes down my chest so that I could breathe. And I had no blood pressure. I'd lost so much blood that they couldn't find an artery to get a line in. So it was probably not the nicest for him to see me like that. And then I was rushed into emergency surgery. So Richard had to call my parents, and we'd only been together a short while, so it was not a fun phone call for him. And then, I woke up 10 days later, so I was in an induced coma for 10 days in ICU. Lots of injuries. Do you want me to go through all the injuries?
Yeah, list them off, man.
Okay, we'll start at the bottom. So both my left tibia and fibula were both compound fractures, so multiple fractures through the bone and had come through the skin. When they came through the skin, they lacerated the tendons, nerves, and arteries in my lower leg. So my leg was pretty messed up from there down. My knee was dislocated, so it was at 90 degrees to where it should be, which ended up tearing all the ligaments in that, as well as the cartilage in that inside my knee. The posterior part of my leg had been ripped off, so there was no skin or anything left. So no skin, no fat, it was just muscle left there. My femur was smashed as well, so that was also a compound fracture, and it was shattered pretty badly, so they had to use bone grafts to put it back together. My right foot and right knee were both smashed, so ligaments in my right knee as well. L3 and L4 in my lumbar spine were both fractured. I had 9 broken ribs or something in my chest, which punctured my lungs, and then I had a collapsed lung. A broken sternum and a shattered scapula, so shoulder blade, shattered humerus in multiple places, so they had to rod that, and a shattered ulna, which is like your elbow bone. So yeah, and a concussion.
And a concussion.
Yeah.
You said like you woke up 10 days later and from a coma. Do you know if you were responsive between the time that you were on the way to hospital, or was it just all
Yeah, so
treating
I
you?
was awake throughout the whole thing, and they said I was quite combative in telling them I didn't need help.
Oh
But
wow.
obviously I did. Yeah, when I was lying on the road, that I was told that I was trying to get up the whole time, which I find a little bizarre because I had broken bones everywhere, so I'm not sure how I thought I was going to get up. But I was trying to go get Richard, so apparently that's what they tell me. But yeah, so they were pretty sure from the start that I didn't have a too serious head injury, just because I was talking to them and that right from the start. So yeah.
Wow. So you woke up out of the coma. Um, how does that sort of all sink in? Like, must be the most bizarre feeling to miss 10 days.
Yeah, it's funny. The first thing I actually remember is my sister laughing and knowing that it was her
Yeah.
and thinking, oh, like something weird's going on, but it must be fine because Kat's there and she's laughing. So yeah, that I remember thinking that pretty clearly. I also remember everything being dark, so I must have still been quite out of it, with like eyes closed and that. And I remember hearing Kat tell me what had happened. So when I woke up properly, I knew what had happened. I was pretty out of it, so I wasn't too concerned, and I wasn't really in any pain or anything. The biggest thing was that I was still intubated, so still tubes down my throat, and I just so wanted them to take them out. And I actually remember quite clearly the doctor coming around one time and looking to see if he could take them out, and me like trying to plead with him without being able to talk, and him saying no. And I just so gutted, oh, please take these damn tubes out. So yeah, tubes are not fun.
No. Had you had any surgeries prior to this mass amount of surgery? Do you know what it was like to come out of a general anaesthetic, or?
Yeah. So I'd had quite a few surgeries before, like just, your standard like knee surgery and tonsillitis and those sorts of surgeries. So I'd had like, 4 or 5 before all this.
And so was it anything like that, or just completely new?
Nah, it was completely different. It was like coming out of nothing. So yeah, there was nothing, and then you just were there, sort of. Yeah. So yeah, it's very hard to describe it, and I guess unless you've actually been through it, it's not like waking up or like you'd imagine. It's not like that. Yeah. I was aware of where I was, but just
Oh, that's a weird feeling. Weird thought. Aware of where you are, but no idea at the same time.
Yeah.
And so, did you have any memory at that stage of?
No. So
Where were you
originally,
last placed?
my last memory was actually treating one of my clients in the new in the new bigger rooms. Was my last memory. The first patient I had on the Monday morning was my last memory. Yeah. But so I also forgot some really random stuff, like Richard had moved in the weekend before my accident, and I still don't really remember him moving in. So when he said that he was living there, I was like, what? When did that happen? Yeah. It's come back a little bit since then. So I remember leaving. I remember the class at the gym now. I remember driving home, parking on the road. But yeah, that's kind of it now.
Kind of it, man. So being a health professional, what was where was your head at when could you see what was going on with your body, or feel, or what?
So for the first few weeks, so I spent 3 weeks in ICU. So for that time, not really. I was in a lot of pain, mostly because they did skin grafts to cover the area of my leg that had lost all its skin in the donor site from the skin graft. So anytime they turned me or anything was just excruciatingly painful. And so I knew I was pretty badly injured, and they told me lots of stuff, but yeah, it didn't really sink in. And you just sort of, I think for a long time I was sort of thinking, oh yeah, she'll be right. Like it'll heal just the same as everything else has healed before. And then from the health professional side of it, it made it easier in that I understood what they were saying, but it also meant I asked a lot more questions, and that's probably quite an annoying patient.
Yeah. No, I remember we were doing a review for Whaitapu, and Dave sort of asked Nigel Kerwish, how were you going? And I hadn't known at that stage. I think it was reasonably fresh, and all of us, I think quite half of the group there hadn't heard yet, and it was just a bombshell. We were just, when they said what happened, it was, and I remember all around the town, everybody just being in shock ourselves. Do you get out to Cambridge much? You said you live in Te Awamutu. Is it a a strange environment?
No, not really. I kept going to the gym there. So
Yep.
the gym was super supportive, Fit Gym. Super, super supportive. They gave me a membership for a year so that I could carry on training there once I got out of hospital. And I trained with Sarah Chadwick. So she was really good. And then I was still on crutches when this is like 4 months down the track after I got out of hospital. I was on crutches and that, so limited into what I could train and couldn't train by myself, but she helped me out. And then, so now I still train there, and I work at Cambridge Community and Sport. So
Awesome.
I'm still in Cambridge pretty regularly.
Yeah,
I
nice.
don't go down that street though.
No. So I guess my question around that is, what was the sort of support around the post-traumatic stress? What was offered, and what have you sought out?
So I was super lucky in that I had really supportive friends and supportive family. So they were all really good there right from the start. ACC have also been really good. So they've offered me counselling and that sort of thing. I don't really like counselling. I'm not a big fan of just being asked constantly how I feel about things. So no, I just didn't find the counselling. I've been to like 3 different ones, and I just don't find it effective. I prefer to get out and do stuff. So yeah, I've just been trying to stay as active as possible really around that side of stuff. There has been issues like definitely post-traumatic stress with sleeping. Sleeping's definitely my biggest issue these days.
And so if you like, what are your best tools for that at the moment?
Trying to keep myself busy during the day, so at least I'm like physically tired.
Yeah.
And it's a lot easier to get tired nowadays. Yeah, and then I've got, like, if I need them, I've got sleeping pills and that sort of stuff, but I try not to really take them too much.
So initially you was it your left limb? Yeah, you kept that initially.
Yeah, absolutely. Yeah.
How was that sort of process, and what did you sort of feel was how you were recovering, I guess? What was that sort of like, and what were you sort of measuring and keeping tabs on, and how was the discussions going?
Right. So right at the start, my family were told that there was a high chance that I was going to lose my leg, just because it was so badly damaged. And they couldn't operate on it for quite a long time just because there was so much other stuff going on. And my body went into what they called a catabolic state, where it was just so stressed that it wasn't healing properly, and I was losing weight like crazy and things like that. So eventually they did operate on it and did tendon grafts, nerve grafts, and all that sort of stuff. Quite a lot of, they used donor bone to make up the bone that I'd lost and put rods through the bones. But the problem was there was always a pretty good chance I was going to get an infection, just because there had been open wounds right at the start. At the start, it looked like it was going to be positive, that the surgery looked like it had worked. I still didn't really have much feeling or anything down there, just because the nerves had been so damaged. So when I got out of hospital, the first time I was in hospital for 3.5 months, and when I came out of hospital, I was doing physio 5 times a week, and we were trying to teach my leg to walk again, but I basically couldn't lift my toes up, so it was like walking, like if you imagine like a stroke victim when they drag a foot sort of thing. So I had quite a bad drop foot and had braces and that to try and keep it up, but wasn't really working. On top of that, I had quite a few wounds down there that just weren't healing. So I was getting district nurses daily coming and checking my wounds, and we weren't getting anywhere with them. And then one day there was just a bit of redness that hadn't been there before, and my district nurse was a bit concerned about it, so she sent me to A&E, and it turned out it was pseudomosis, which is an infection in the bone. And the infection had eaten away all the tendon and nerve grafts that they'd done. So basically we were right back to day one, like even less than that. They couldn't operate because there's so much infection in there. So I was readmitted to hospital, and they were just doing washout after washout. So I think it was like every second day they were doing washouts, trying to get rid of the infection. And I was on heaps of antibiotics. My surgeon at the time, I think she kind of had thought of me as like her little like pet project, where this ankle was so smashed, but she was going to fix it and she was going to make it work and all this. And I remember talking to her one day, and obviously being a physio, I was wanting to know how much movement I was going to get back in it. And she said, oh, you might get 90 degrees. So like, which is like a flat foot. And I was like, well, I won't be able to walk with that. And she was like, oh yeah, you'll just limp for the rest of your life. And I was like, well, I'm not keen on this. And that was like best case scenario. So I asked for a second opinion. So another surgeon came and saw me, and he was a lot more function focused. So where the first one had been quite impairment focused, she just focused on the ankle, where he was more focused on what my life was going to be like with this ankle and how much I was going to be able to do. And so after talking to him for quite a while, he agreed with me, and the amputation was probably going to be the best way forward. And then after that, it all happened pretty quick. Once I said, I had to like sign things to say that I was going against my original doctor's recommendation. But because I really trusted this other doctor, and he was really awesome. So and just having the knowledge that I had, like, I knew it wasn't coming back. I talked to a few physios and that sort of thing, got a few professional opinions, and everyone's opinion was that I was going to be better off without it. So yeah, so then I made the decision to amputate, and I think they did it like a week later.
Shit. Yeah. And was all this done in Waikato, or did you have to get moved
Waikato.
around? Oh, that's...
No, yeah. So everything was Waikato at that stage. These days I'm more private, but yeah.
Mm-hmm. In Hamilton still, or are you going up to Auckland?
Hamilton.
Yeah, Hamilton still. Oh, right. And so with staying on that thought of functionality, how high up was the nerve damage? So was the muscle going to ever be reinvigorated and, connected and all that sort of stuff?
Yes, I've had multiple nerve damages. So my left arm was paralyzed in it originally.
Yeah.
And then my femur cut through, when it came through, it cut through the nerve that innervates VMO, which is quite an important one in your thigh. So I don't have much of a thigh anymore. But yeah, the ones down the bottom, like I had no movement of my foot, no active movement, like no feeling. Yeah, so the muscles would have just wasted away as well. Yeah.
And so what was done with the lumbar spine? Was that all on that left side where the break was, or right across?
Right across, yeah.
Yeah.
They were stable fractures, so and because I had so much other stuff, they just kept an eye on it. And yeah, I get quite stiff through there now, but other than that, it's not too bad.
And so invigoration from there, that wasn't damaged?
No, I was real lucky in that aspect. That, yeah, no, my spinal cord and everything was all okay.
Oh man, yeah. And so, where's the sort of pain at now? Is it wax and wave, or chronic, or what do you sort of have?
So I get quite a lot of phantom pain, and not everyone understands what that is, but it's basically pain in the area in my foot, which isn't there. So it can be quite frustrating, as you can imagine. I get quite a lot of it at night. At the start, I can't even describe how horrendous. For the first probably 6 months was just, I get shocks like I sat on an electric fence or whatever and through my foot, and obviously you can't do anything about it because the foot's not there. But it's settled down quite a lot now. So I get a bit of it at night. At the moment, I've been getting quite bad night ones. I've noticed it's quite dependent on my emotional status. So if I'm quite tired, then I'll definitely feel more phantom pain, that sort of stuff. If I'm feeling a bit down, I'll have more phantom pain. I get quite a lot of pain in my stump at the moment, so that's something they're trying to fix at the moment, but getting there.
Yeah. And so how broad do you go? Like you said, there's the bones are an immune center. You had a lot of infection, you had a lot of antibiotics, and also the nerve pain probably is hijacking some of your regular autonomic nerves. How broad do you go in terms of repairing you as a full body?
Yeah.
Or are you still in the management stage still, do you think?
Still there. So we're up to 22 surgeries now.
Wow.
since my accident. But yeah, they can never really tell me either. Like they're just like, oh, we'll just keep going. We'll just keep going. My knee's pretty screwed, like obviously because it had been dislocated quite badly, and then it was obviously being on bed rest for so long, it didn't get any movement, so I don't have much range of motion in my knee. And the last set of scans I had on it showed that I had grade 4 chondral damage, so basically like into the bone damage through the cartilage and that. And then because once you're an amputee, they're a little bit funny about trying to repair things like that. So yeah, that's just a waiting game on that one too.
And so from your perspective, are you sort of thinking the articulation of the knee as it inserts into the prosthesis so you can move it, or what's your thoughts around that?
Yeah, I can move it. It does make things complicated, but yeah, they're pretty good at the limb center about moving it around it. Like they know I have a bad knee and that sort of stuff. So yeah, it's just managing it really.
And so how much rehab work had you done during uni? Was there anything that really caught your fancy, or it was mostly about sports physiotherapy?
It was sports. Yeah, I mean, I think we do like a real tiny bit on it, but no, not really.
Yeah. And is that probably somewhere where occupational therapy takes over from physio a bit more?
I haven't really had much of an occupational therapist. I had a real good one when I was in hospital, and she did pretty much all my stuff, but I would say she was crossing over into physio territory really, but she was just real onto it, and I got along real well with her. So she did pretty much all my rehab while I was in hospital. And then through the limb center and the amputation side of it, it's been mostly physios. There's like specific physios at the limb center that work just with amputees, but it's not really like rehab like you'd imagine, like, you know, from a sports injury. It's all just like testing on what level you are and what your function's like, and then teaching you, like, you know, how to walk downstairs with a prosthetic or that sort of stuff. It's not the same. Yeah.
And so then the physical therapy at the gym, has that been a learning curve for them, or what's that been like?
Yeah, I imagine so. Yeah. Yeah. So I'm still training with Sarah. So I've trained with her since I first got out of hospital. And yeah, I would say she's definitely learned a lot about working around injuries and that. And actually one of my friends started training with her too, who snapped her Achilles. Ooh. And I was like, she knows what she's doing, like with the, you know, you're on crutches and can't move around very well, but want to train other areas of your body and that. So no, yeah, she was real good on that side of it.
And from your unilateral perspective, how much sort of movement and training can you work on that other side?
So I try to do a fair bit of on my good side. Yeah, I don't know how much crossover you get. Like the idea is that you do get some crossover, but yeah, I'm not sure how much.
Not sure how much. Yeah. If you don't mind, obviously you said the person was obviously in shock afterwards because they kept driving. What has been the sort of restorative justice process for that, and how much have they involved you, or it's been very much their criminal process?
Yep. So no, they're pretty involved. So he pled guilty straight away, which was a relief for me. And did change the process of things quite a lot. So we had a court case that we had to go to, and I had to read a victim impact statement. So both Richard and I read those out. We did restorative justice. So it's called a restorative justice meeting, which was ordered by the judge. I didn't actually have to go, but I decided I would. So basically we met him and his mother and just talked, and, you know, he apologized and that sort of thing. And then he got 175 hours of community service, lost his license and paid a fine. But I think he's pretty remorseful. Like, you know, he sends me cards and at Christmas and that sort of stuff. So yeah, no, I mean, it's just one of those things, really, isn't it?
Yeah. And is it something that he's got a criminal record for, or?
I actually don't know if he gets a criminal record for that or not.
Yeah. You know, I always think about that. You know, as a young person, a severe accident like that would still change. Will have changed his life severely as well. Yeah. But then that on top of it could
Yeah.
could mean,
Yeah,
things
he's
down the
paying for
track.
it forever. Yeah.
Yeah, no,
Yeah.
it's gnarly. You said that you like being quite active. What sort of things help, basically?
So I have a dog.
Yeah.
So I got a puppy like 6 months after I got out of hospital. And so she's pretty active. So I have to take her to the park and that quite a lot, and that's always quite a good release for me. So I do quite a lot of walking around
Mhm.
just around the park or whatever. Still train heaps. I joined a swim squad,
Yeah.
so that's probably been my main thing. Yeah, that's been awesome. Like, yeah, good. Just low impact, doesn't affect my leg. It's real good for my shoulder, and yeah, just it's a good way of getting a bit of cardio in, which I otherwise can't get. Depending on how my leg's feeling, I do weights, but yeah, it just depends on how well my socket's fitting at the time and that. We went snowboarding a few weeks back, and that was pretty hard, but but managed to do it. So I was really stoked about that. But yeah, it's just I still do all the same stuff. I don't think the only thing I'm really not doing that I used to do a lot of before was running, and
Hmm.
hopefully at some point I'll be able to. But yeah, not yet.
Yeah. And so tell us about the ocean swim. How did that come about, and how did you feel afterwards?
Yeah. So how
Or
did that
open
come
water
about? I
swim,
think
wasn't it?
yeah.
Yeah.
So I think it just I just wanted something to aim towards, and I was like, oh, I've never done this before, give it a go. And then a friend of mine ended up doing it with me as well, so it was some good motivation. Yeah, that was real cool. Actually, I had a PB doing it, so I was pretty stoked. Yeah, it was real fun, and they were real good about because I obviously needed help to get into the water and to get out of the water and that sort of stuff. So it was a good achievement. I felt quite stoked about.
Hmm.
We're actually doing a half Ironman at the end of the year, so doing the swim on that too. So we'll
Nice.
see how that one goes a bit further.
Where was the first event, and where's the next event?
So the first one was at the Rotorua Blue Lake.
Hmm.
Yeah, and then we're doing the Taupo half Ironman. So I'm doing it in a team with Richard's going to run, and another friend of mine's going to bike.
Fantastic. No shortage of people who ride a bike and run around
Yeah.
Waipa, that's for sure. And so you said you got a new role now with Cambridge Sport, Waipa Sport, can you say?
Say that again, sorry.
Who's your new role with, sorry?
Cambridge Community and Sport, yeah.
Cambridge Community and Sport. And so what's that involved?
So they've been actually amazing. Like, obviously I'm a little bit limited into how much I can work at the moment. I have to be cleared from ACC to be able to go back to work properly, and I haven't been. So I had an assessment with ACC and with a proper medical assessor, and he basically said I was a couple of years off being able to work, just because I'm obviously get quite sore on my leg, and I get quite bad fatigue from the head
Mm-hmm.
knock. But I was going crazy, so I talked to ACC and they were okay with me doing a few hours. So at the moment I just do Mondays and Thursday mornings, and yeah, the boss there has been awesome, and just the whole team is super supportive, and just don't really push me too hard or anything, and just let me do what I can do and that sort of thing. So it's been real good. So it's just doing the same stuff as I was doing before, minus the sports teams.
Yeah.
But yeah, it's just been awesome to just get back, and I studied for so long to be a physio, so it's good to get back into it, and it's what I enjoy. So
Yeah. And so specifically, what is it that they've got you doing?
so just musculo physio. So I'll be seeing your backs, your necks, shoulders, whatever. Yeah, whatever it is. So a range of patients ranging from high school students right up to elderly, and yeah.
And that's a clinic again, or?
Yeah, just at a
Yeah.
clinic. Yeah.
Oh, nice. And you mentioned your family. Is it you go to them, they come to you, all of the above?
All of the above. Yeah. No, they've all been real good. So I don't think my dad barely left the hospital the whole time I was there. And yeah, when I was in ICU and that, they were all there. And yeah, them and a couple of really good friends just were really good about coming in. Like I said, I lost a lot of weight, and then the hospital were trying to put weight on me, but they feed you disgusting foods. So so I had some good friends started cooking me dinners and did a little roster and bringing me dinners in. So I was really lucky on that side of things.
Yeah, my granddad's just been in hospital for a broken limb, and obviously he's 92, so they didn't do anything for him. But yeah, trying to feed him up has been one of the things. And Mum was like, "Oh, he's going to have a can of Sprite." I was like, "Oh, but he's trying to recover." And she's like, "He won't eat anything. He gets these disgusting protein shakes that he throws in the bin."
I have those too. Yeah, those. Ugh, are you trying to drink them? You're like,
Yeah, I was talking to her yesterday, and she said that they nurse will bring it in the morning and it's down the windowsill all day, whereas now he keeps it refrigerated, and he's also got something else to, you know, he won't mind me talking about him, but help him go to the bathroom. So I think the protein shake has now become the lesser of two bad things that he's got to consume. So
yeah, been there.
oh dear,
yeah, that was actually one of the hardest parts of the whole thing, just being so like dependent on everyone. I couldn't go to the bathroom by myself, couldn't shower myself, couldn't even roll over in bed. That was hard.
And so have you had to adapt the household much, or the crutches and things have been good enough? I don't know.
Well, to start with, because my arm was paralyzed, I couldn't use crutches.
Yeah.
So I was wheelchair bound for probably about 6 months or so. So yeah, we had ramps and that at the house, and commodes and that sort of stuff, so you could go to the toilet, and little seats in the shower and I had carers come in daily to shower me and feed me and all that sort of stuff. I obviously couldn't do anything at all myself. I couldn't even dress myself. And then as I've gradually got it better, we don't have quite as much stuff now. I still have ACC changed our bathroom around because we had a shower over a bath, which I obviously can't get into very easily. And so now we have a wet area, so I don't have to little lips and stuff are quite hard to go over. And to shower in that, I have shower stools and seats and that sort of stuff. They changed our kitchen around a little bit, just in that they gave us seats and stuff that I could sit on, so that I could roll around rather than have to try and stand at things. And I can't really bend down to get stuff out of low cupboards, just because my balance is terrible nowadays. So yeah, there's been different things all the way along that they've given us. So used quite a lot of equipment.
And are you much of a cook?
I used to be. No, I don't mind cooking dinners and that, and doing the odd bit of baking, but yeah, not too much.
And it's just because it's as a strain or awkward, or
it's just too hard now.
Yeah,
it's just I can't really pivot. So to move around the kitchen, you pivot quite a lot, and then to get down to get stuff out of the oven or a low cupboard and that sort of stuff is just it's difficult. And so I just don't really bother.
You say about that pivot was something I never ever considered. Was at a friend's the other day, and they told me about the design of their kitchen, and they said you can either have a square or a triangle. And I was like, "What do you mean?" And they said, the triangle one, you just pivot everywhere you want to go, or the square one, you have zones which you use.
Yeah.
Oh, no way.
yeah.
Ergonomics of a kitchen. So I guess that was probably what they were trying to consider with you. What they can do for you.
Yeah.
That's tough. And did I see you talking to a group of people? Was that right?
Yeah. So I've done a couple of talks now. So the first one I did was to a TRA youth group, and a heap of the community showed up as well. So quite a few people were there. And basically just talking about the impact of driving distracted and why you should stay focused driving, not using things like phones and those sorts of things. And then I talked about basically my journey so far and what I've been up to and that sort of thing. And then I did another one at Fairfield High School. So talked to all the 6th and 7th formers there. And at that one, I actually met a cop who was also doing a talk to them. And then he asked me to come along to a program they run for repeat offenders. And so I am getting involved in that one now. So I will be doing talks to them as well. In
terms of them catching people texting and driving, or in terms of drunk driving and that sort of stuff?
It's a bit of everything. So for them, they're just repeat offenders. The last lot, it's like a program. I think it's 8 weeks that they have to complete, and it's court ordered. And there were things people doing like loss of traction and drink driving and distracted driving and all sorts of different things.
And so, have you looked into sort of the impact of that on a broader sense, or you've just been talking about your own story, which is, hugely powerful for anybody out there that still, uses their phone while they're driving along?
Yeah, I haven't looked too much more into it. I have been told that I should, and that I should probably do more talking. But yeah, yeah, I'm not I like pretty open to it, but just I should probably organise it more.
No, that's totally fine. I'm sure everyone will understand listening to this that there's a lot on for you at the moment, and a lot to take up your focus. So when you're a physio, you're quite goal oriented, and of course doing that course takes a lot of steps and a lot of dedication. Where are your horizons at the moment?
Yeah, so there's a couple of things that this summer is my short-term goal is to wakeboard again. So we will see, because I used to do that quite a lot. So my dad and I do it together, and normal summer I'd go 3 or 4 nights a week.
Yeah.
I reckon I'll be able to, but I think getting up is going to be the tough part. I was able to snowboard, so I reckon if I can snowboard, I can wakeboard, but we'll see. Getting back to running is one of my I just really can't wait to be able to do that, but also not sure depending on who you talk to, depends on whether they're like surgeons and they're like, oh, you won't run again, but they don't know.
There's plenty of examples of people proving that theory wrong.
Yeah, exactly. And then just getting back to working full time is like, my other focus. Like, just I miss work, so miss work quite a lot. But yeah.
And so with the running, is it something that a blade would be possible?
Yep. So at the moment, the problem is that my stump has been a bit of an issue. So I've had a few different surgeries on my stump. So I had one 6 weeks ago, so now. Mine was my most recent one, where I had a neuroma in behind my knee, which is basically a nerve cluster. And when nerves get damaged, they do all sorts of silly things. And because I don't have much skin there behind my knee now, so I have no fat or anything in behind my knee, so there's no protection. So my prosthetic was just rubbing on it all the time. So that was meaning I couldn't really wear my prosthetic half the time and those sorts of things. So they took that out, and it's been quite a lot better since then. But I still have quite a bit of pain in the end of my stump, which makes fitting a prosthetic quite hard. So I kind of can't get any of the better prosthetics, so like a blade or those sorts of things, until they can get a socket that fits comfortably. So it's a very long process, and they're quite busy at the limb centre, so it's it's a waiting game.
And being quite scientifically minded, do you sort of look at the new and emerging stuff, like you hear miracle stuff about stem cells and PRP, which not really viable in New Zealand just yet? How does that conversation go, or do you just not even bother to have it?
Yeah, so I follow quite a few of those companies on Instagram, from like the States and that.
Yeah.
And some of it I'm like, oh my God, I want to go to the States just so I can check out this stuff. It's so cool. They have some really cool stuff over there. So just hopefully eventually we get it here.
Yeah, and something I've talked about a couple of times, and that's CBD, both from a neural perspective, a concussion perspective, and a pain perspective, all of which none are going to be, legal, or I guess that's not the word. It's going to be non-banned substance in December, but the only indication for a prescription is going to be MS. But talking with a pharmacist the other day, there's potential for off-label, and he said that a lot of general practitioners are already using it off-label. Is there something like that anybody that's allowing a conversation like that with you?
Yeah, so I've actually done quite a lot of research into CBD. And because I don't take many medications, I don't really like taking them, and a lot of the ones that you use for pain and that are quite addictive. So I just don't take them. But CBD is not. It's got like none of the side effects that like opioids or anything have. And the trials from the studies that I've read and the trials that they did, they had really good results in phantom pain and stump pain and that sort of stuff. So I would definitely go down that track if if I could.
Yeah, bring on December and let's see
Yeah.
what happens.
Yeah, definitely.
Right. And from the traumatic brain injury, do you have any lasting symptoms of that? Like you said, concentration and stuff, but you've got a full body nervous system going
Yeah.
on anyway. But is there much specifically around concussion that you're noticing, or?
Not a lot specifically to the concussion. Like fatigue is definitely my biggest issue at the moment. Which, I mean, you can blame that on quite a few things. Like obviously having a lower limb amputee, you use more energy just doing everyday stuff. I'm still healing. Yeah,
Yeah.
you know, those sorts of things. So yeah, so whether it's related to the head knock or whether it's just part of multi-trauma, yeah.
Mhm.
But yeah, that's really the only thing. And obviously still a bit of memory loss, but yeah, I struggle with computers a bit. So if I'm in front of a computer for too long, like, yeah, I struggle with that a little bit, but it's all totally manageable from that side of it. Yeah.
Mm. And you said now you've gone a lot into the private sector for health. Do you have sort of a team, or is it still quite compartmentalized?
No, so after I came out of being in the public sector, I was sort of able to choose my own surgeons, and I actually kept most of them. So I have I had a huge team of surgeons to start with, and it's come down quite a lot now. So I have two orthopedic surgeons and a plastic surgeon at the moment,
Mm-hmm.
and I
And they're
choose the
all
same ones for everything. Yeah,
and they're all working together. Like it's a
yeah, they all
discussion
work
about each
together.
time.
Yeah, yeah.
And
And
so,
actually, the few times they've done like surgeries together and that sort of stuff. So if there's multiple parts that need doing and they can do it under one general, then they work together and that sort of stuff.
so you are mostly going under general.
I've had all generals, yeah.
Oh wow.
Yeah. So probably it doesn't help the fatigue.
No, I don't know if people sort of realise that it can take a year or so to get out of the amnesia like symptoms out of that. So
Yeah.
have you got a tally of how many generals you've had?
22, yeah. 22 since September 2017.
Christ.
Yeah.
No,
Yeah, quite a few. I'm always like, every time I say that to them when they go to put me under again, I'm like, is this okay? How many I've had? And they're like, oh, you're fine. Okay. But it is definitely accumulative. So like I feel worse after each one.
Mm.
It takes me longer to recover after each one.
And could you describe what those sort of symptoms and feelings are?
So I'm quite lucky in that I don't get the nausea, where a lot of people seem to get quite nauseous with generals. I don't really get that. I just get real sleepy and like out of it sleepy. So like you've just been real drugged, obviously.
Yeah.
But yeah, and I'll be like that for several days and just sleep nonstop sort of thing. And then it takes me weeks to recover. So
Yeah.
quite often I'll spend like a Saturday all day in bed just to like catch up.
Yeah. And so do you sort of feel a little bit like a bubble person? Obviously your immune system's probably a little bit struggled. Do you, so anybody that's sick don't come anywhere near?
Yeah, I'm a little bit like that. When people get sick, I'm like, ugh. It takes nothing to make me sick these days, so stay away.
Yeah, no, that was the worst flu I ever had. I think it was 2 months after my surgery, I got the flu and fever and death. So I can only imagine. Yeah,
it takes forever to recover from it too.
yeah. Oh man. And so is this going to be something that people can follow the journey of Naomi, or are you going to still keep this quite quiet?
People ask me that quite often. Actually, a lot of my physio friends in there are always like, "Oh, post more stuff. We're trying to follow you." I'm not real good on the old social media side.
Yeah.
But no, yeah, I'm completely open about it. Like I don't mind people asking questions and that sort of stuff. And yeah, they can follow me. It's just that I'm not real good at posting stuff.
Yeah.
I do update every now and again. I'm like, oh, I haven't done that in a while. I'll update. But yeah.
It's probably a good attitude, you know. There's plenty of addiction issues when it comes to social media, so having it not mean the world to you, it's probably a great spot to be in, I guess.
Yeah.
Nice. And so, do you think you've learned anything profound from this? You know, talked about it before, the sort of new age mysticism or whatever sort of says that life happens to you, and something like this is hard to sort of justify as happening for you. Is there anything that you sort of think is meaningful out of it?
Yeah, I struggle with that one when people say things happen for a reason. This wouldn't have happened to you if you weren't strong enough to deal with it. Rah-de-rah, that I kind of want to punch them.
Yeah.
Yeah, I don't know, anything profound. I guess shit happens and you've got two choices really, don't you? You either let it get to you and sit around and mope, or you just carry on. I think the biggest thing I've learned is, from a patient point of view, it's probably made me a better physio, just understanding that side of things a little bit more. Understanding how bad it can be at the hospital too. Like, they just don't tell you the facts. And like, I was in a position where I knew what to ask and what questions to ask. But I think if you just trust your doctor fully, and in that position you generally do, they can probably, you're in the dark a lot of the time. And so definitely I was a little bit shocked about how bad that can be, that side of it can be. But also, I think I have a better appreciation now for fitting things in. So when I tell a patient that they need to do these exercises 3 times a day or whatever, and I'm like, I know you're not going to do that. Now I'm like, yeah, that's actually really hard to fit in. So that's probably the thing I've learned the most from it. And, nothing profound, I wouldn't say. Not yet, anyway.
Just on that, is it true that you guys tell us to do more than what you actually want?
Depends on the patient. yeah, if it's one that you're like, he's not going to do this, I'll be like, yeah, you do 50, and then I'm like, he might do 10.
Yeah.
Every now and again you get like the 1% who do too many, and so then I tell them to do half of what I want them to do.
No, very good. Oh, thank you so much, Naomi, for coming on. As I said, I saw you started to talk about it and asked if you'd like to come on, and you've actually tuned up episode number 100, so you're
awesome.
you're a landmark as well. And yeah, just thanks so much for speaking so openly and freely about what really is, the day that changed everything, as you said, about your life. And yeah, I still remember hearing that news, and we were all in shock. And it's awesome to see that you're moving forward. Thank you.
Thank you very much.
I'll press stop.